Hi everyone, this is Ashish. I am a finance professional with 15 years of experience in banking and investing. I recently made the switch from finance to working on food and nutrition as drivers of long-term health. So here I am with my very first YouTube video in an attempt to explain who I am, why I made the switch, and what I'm hoping to do here. After completing my engineering from IIT Roorkee and MBA from IIM Calcutta, I started my career in investment banking at Credit Suisse. After a few years there, I moved to do private equity investing, first at TPG and then at GIC. While I worked across sectors, a lot of my time was spent on healthcare services, working alongside seasoned investors and management teams. And it all made me believe that our private healthcare system is actually doing very well. It has adequate access to capital, new technology is coming in, infrastructure is expanding rapidly, and most important, we are able to treat very complex cases with more successful outcomes. So it all looks very good. Yet, in all of my presentations, I used to see increasing disease burden across the globe and especially in India. So we have 15% to 17% of world's population, but almost a quarter, 25% of world's diabetics. Can you imagine? 25% of world's diabetics live in India. And this situation is not only in rural areas, even urban areas with better access to healthcare and education are seeing similar trends. So it always used to make me wonder why this difference. Why is it like this that we have a world-class healthcare system, yet our disease burden keeps growing? And it's not only in data. You see around yourself, family, friends, people suffering from chronic issues, hypertension, blood pressure, diabetes, even fertility these days is becoming so common. And more complex issues such as heart ailments, cancer related issues, people facing all of these much earlier in life than they used to do earlier. So I always used to question, why is it that our system cannot focus as much on prevention as it does on detecting and curing the disease? And if you actually think about it, the answer is not complex, it's very simple. Because prevention is a very long-term game and it is very difficult to measure. It's difficult to say that this outcome was led by this input. And as a result, you cannot measure it, you cannot distribute incentives, and so it becomes tough. Secondly, if prevention works, you have lesser patients, lesser demand for services and infrastructure, which means the system needs less capital as a whole. And hence it obviously does not get the attention that it needs. Effectively, prevention does not fit the business model as well. It's not an issue of intent. It's just how capital and systems work. So now, if capital cannot support prevention, then obviously the responsibility has to fall on society and individuals to proactively plan health and not think of curing health problems. We need to make that conscious mindset shift that we need to plan our health proactively. And if we need to plan our health, then obviously we have to see what's the input that goes into our health. Because if we do not change the input, then it is not possible to expect a different outcome. So talking of inputs, there are three big inputs: air, water, food, which determine our health in a big way. Now, air and water are very difficult to control, but food is something which is very powerful and yet so ignored. We interact with it several times a day throughout our life, but we always treat it like a lifestyle choice, as a matter of taste, preference, but rarely as a biological input which can actually make or break our health. So I had two very personal experiences which proved the power of food to me and are the key reasons why I decided that this is a worthwhile goal to pursue. The first one, I went to a 7-day naturopathy course at a Nirvana Naturopathy Center near Nasik. And while I sensed the impact of food on myself, what was interesting for me to see was that we had chronic diabetic patients there, people taking insulin for several years. They went through 3-4 days of structured program with supervised diet and controls. And from 4th day itself, they were fine without insulin. Their blood sugar levels were stable and they could operate. And it was amazing for me to see that, okay, something as simple as food can be so powerful to treat a disease which I always thought modern medicine is the only way to do it and you need to take medication for life. So it was really an eye-opening experience for me. The second one was even more personal. My wife's 2 pregnancies, 6 years apart, but very different experiences. The second one, thankfully, was much smoother. No protein deficiencies, no painful injections, better weight for the baby, and overall much smoother than the first one. Same person, same genetics, 6 years older. The only variable that changed was nutrition. In the second one, we focused a lot more on eating properly as per her bodily requirements through the phases of pregnancy, and we also had assistance of an expert dietitian, and that made all the difference. So if you think about it, it was so amazing to see food affect the formation of new life in such a significant way. So driven by my professional experiences in healthcare and my personal experiences to see the power of food, paying more attention to food as I see my kids growing up and eating, all of this made me decide that I should switch from investing to food and nutrition as a driver of long-term health. I don't really have it figured out. I don't know how this will look like because this is completely different from what I have done all my life, but I just know that this is important and it will have an ability to create an impact on people's lives, and most importantly for kids who are in their formative years. Any intervention, any change at this stage will benefit them for life, and so that is what I'm hoping to do. So what is this channel about? Honestly, a bit of everything, to share my learnings, my experiences, my findings about food systems, key issues that we should be mindful of, how we can work around them, inspirational examples, discussions with experts, basically anything and everything that will help me learn and that will support my cause of spreading awareness about food as a key driver for health and wellness. You will also see me writing on LinkedIn as well as start a newsletter for long form content, especially for people who love to read. So if any of this resonates with you, I would love for you to come along for the ride. You can check out some of my other videos on my channel as well. And I hope to see you again soon. Till then, stay healthy and have a good time.